Greetings and welcome to Dean Linda Freed, our commencement speaker Dr. Paul Farmer, our esteemed faculty, our diligent staff, graduating students, and guests. I'll begin by congratulating the class of 2009 on your myriad accomplishments and your matriculation at the Mailman School of Public Health. My fellow students, whenever you mention that you are pursuing a public health degree, more often than not, you can expect the posed question: what exactly is public health? Public health is compassion. It is civic duty, collaboration, and cooperation. It is cultural competence. It is the quest for cure. Many words are used to describe this field, and although lucrative is not among them, the importance of our work is undeniable. Our generation faces tremendous health challenges of unprecedented nature and magnitude. The health implications of old age are increasingly relevant to our field, and the rapid aging of our society will require us to reevaluate our priorities. Cardiovascular disease, diabetes, obesity, and various cancers continue the fight for life in millions of Americans, and the effects of globalization propagate this fight worldwide. HIV/AIDS continues to evade cure and devastate the world. Threats of terrorism keep us on constant guard. In addition, our faltering world economies are producing stressors that damage our health and exacerbate health outcomes. Mailman has heavily armed us with the broad study of science and sound ethics, and from this arsenal, we must combine our facts and our principles to effectively address these challenges. Public health is a brilliant spectrum of approaches that unite in the common goal of meeting the need for health care. The departments of the Mailman School capture this brilliance. Epidemiology. You ascertain the origin, progression, pattern, and control of both infectious and chronic disease and illness. You keep the public safe, whether by battling the swine flu pandemic or by staying abreast of those still affected by the September 11th attacks. You also provide the frameworks necessary for our studies to generate greater understanding of the diseases that affect us. Health policy and management. You provide the bridge between theory and regulation and provide the means to implement findings of public health research. You govern the various institutions that affect health outcomes, ensure the proper delivery and distribution of health resources, and enact the laws that benefit the public's health. Biostatistics. You provide us with the mathematical competence to legitimize our evidence and to separate the pearls from the mud. You remind us that all aspects of our lives are founded in mathematical structure, and the statistics you produce yield the discovery of our goals, the authority of our intentions, and the validation of our actions. Environmental health sciences. You discern the health implications of our treatment of Mother Earth and the elements of human civilization that threaten our survival. You lead us in the fight against the adverse effects of climate change, pollution, pest control, and other sources of ill health, and you will lead the world in harnessing the power of the planet to preserve life. Population and family health. You are the faces and the front line of public health. Whether you are a relief worker in a refugee camp or an HIV counseling specialist in a community center, you address the needs of the most vulnerable members of society and ensure them access to tangible help. Socio-medical sciences. You examine the relationship between physical and social disease. You discern how stigma, prejudice, poverty, and other ills affect community health, and you work within communities to create healthier conditions. You help us to find a balance between the order of health science and the chaos of human behavior so that we may succeed in our efforts. And finally, global health. You combine all of these approaches and apply them in a global context. You support developing and transitioning countries in promoting the health of their citizens, and you engage developed countries in such efforts. Like the colors of the spectrum, without each band, there can be no light. We cannot enact effective policy without high-quality supportive evidence. We cannot fight disease and illness without addressing their underlying social and environmental causes. And we cannot attend to the health needs of populations without the proper designs for our plans. The synergy of these approaches is essential to our success. The election of President Barack Obama has fostered optimism that the United States will make a more concerted effort to provide health care to all Americans and to orient the U.S. medical model towards prevention. Public health cannot be the Band-Aid on a gaping wound. Also, in these tough financial times, the strength of our economy inevitably lies in the resilience of the American people. Thus, our efforts in securing health are key to economic revival in the United States and beyond. That being said, we cannot be intimidated by the arduous tasks that lie ahead of us. Whenever interventions fail to produce results, when seemingly suitable policies backfire, when the odds seem that they are against us, hope is never lost. It is the faith in ourselves, in our communities, and in our countries that motivates us and propels us forward. In closing, I invite you to take this time to reflect on the journey that brought you here. Some of you knew that public health was your home and came straight from your undergraduate programs to seek a New York destiny. Others of you, like me, gave yourself to the winds to discover your true passion and calling. Whatever your individual journey was, know that you are here to serve a purpose, a providence-determined purpose to bring well-being and longevity to the masses and to benefit your society and your world for years to come. We came to discover why we live to be raised and navigated a maze to be worthy of praise. We sought and pocketed knowledge as wealth in promotion of health, in realization of self. To be pioneers in our new careers, in places far and near, through partnership with our peers, in the papers we write, with the pieces we've read, for the people to see better days ahead, with the strength of body, mind, and soul for the young and the old. This is our goal. Congratulations, class of 2009, and warmest wishes for your futures. Thank you.